Assalamu alaikum everyone. Today we're going to talk about optic pathways and some kind of lesions according to the location of the optic lesion pathways. First of all, we should talk about the optic system of the eye and carriage of the optic impulses to the hemispheres. Okay. First of all, look at that's the view of the object. Okay, and the small circle at the center of the large circle is the part that's responsible for macula. Okay, you know the macula is responsible for some kind of focused objects. Okay, when you look at and studying this object can be appeared at the macula, and around this object background view is passed through the lens and located this part of the retina. Okay, and look at that, and you know, according to the optic part of the physics, you know about some kind of lenses. Okay, this lens, and its main function is reflecting the object. Look at that. If this pencil, look at that, and human eye is watching this object. That's a pencil or marker. Okay, and this part of the pencil direct to the lens, and the lens reflect it, and this view appeared this part of the retina. Okay, and this part of the object pass through the lenses and appeared this part of the object. Okay, and it means that when you look at this object, it appeared in the macula this position. Okay, don't forget that. And according to this rule, we should locate some kind of parts of the objects in the macula and the whole retina. Okay, and when you look at this part, and this part passed through the lens and appeared this part of the maculas of both eyes. Okay, and in the red color, when the pass through, it can cross the lens and appear this part. Okay, don't forget that. And when we talk about the background view of the retinas, background view, the object and their appearance in the retina is, when you look at the upper left quadrant, it can cross the lens and it can appear the lower right quadrant of the retina and something like that. And all of the other three parts will be appeared like this. Okay, and that's the retina and the location of the objects due to their location in the real objects and their location in the retina. And the retina's main function is accepting the impulses and directing to the hemispheres. Okay, in our previous lesson, we provide information that all of the information that's in the retina, in the temporal part, cannot cross and direct impulses laterally to this part of the hemispheres. Okay, and this part of the hemispheres, like it is this part of the hemispheres, and this part and this part don't cross and arrive there. Okay, and look at that. And this part and this part in the retina don't cross and appear there, these parts. Okay, and we should provide information that and the nasal part of the retina, can cross and direct impulses contralaterally, and from the nasal part of the retina, the impulses direct to contralaterally and locate there. Okay, and please look at that, and the parts of the hemispheres that's responsible for accepting the impulses from the macula is located this part in the black, and green color. Okay, that's the view in the object. That's a black and green color appears this part. Okay, and blue and red color appears there. Okay, don't forget that. And the dotted objects I illustrate there as a periphery, and located these parts of the retina, and they are directed to this part and this part and these parts, I should say that the object appear both retinas, and both retinas direct these impulses to the same part of the hemispheres. Although it's difficult to understand, but we should concentrate on the physics of the optic system, of the visual system. Okay, and there is directing the impulses to the hemispheres, and in this illustration you should know about and get some kind of information about the neuroophthalmology. You know, the neuroophthalmologists who are responsible for learning and curing the patients who are suffering from the lesions that's located in the optic pathway. Okay, our first lesion is located in the nervus opticus. According to this illustration, that's the right eye and that's the left eye. Okay, and when the lesion takes place at the right optic nerve, the right vision can be lost. Okay, because all of this view couldn't conduct it to the hemispheres. And the next lesion, please, I should talk about the reason of this lesion is some kind of tumors, maybe traumas, and intracranial hypertension can cause the damage to the optic nerve and can cause the papilledema. Papilledema means that there's some kind of swelling in the entrance of the optic nerve from the retina. Okay, in the papilledema, the optic entrance can be swelled and it can impinge on the conductance of the visual impulses to the optic nerve. Okay, and the next lesion is located there. You know, from the temporal part of the retina, the impulses conducted ipsilaterally to the right and left hemispheres, to the right hemispheres without crossing. And one of the main causes of this damage is compressing of the hypophysis glands. Okay, some type of tumors of hypophysis glands can compress from both sides of the these parts. Okay, when these fibers compressed, the patient has some kind of difficulties sending the information from the temporal parts of both eyes. You know, the temporal parts are responsible for accepting impulses from the medial part of the objects. Okay, according to this, the patient have some kind of difficulties with medial part of the objects, and we can call this situation binasal hemianopia. Okay, binasal. Okay, and the next damage is located there, and when this crossed part of the nervus opticus compressed by hypophysis tumors, it can impinge on the conductance of the impulses from the nasal part of the retina. You know, the nasal part of the retinas, both retinas, is responsible for accepting the impulses from the temporal part of the objects. Due to this, the patient have bitemporal hemianopia. Okay, and the next lesion is located in the optic tract. It may be due to some kind of tumors and another kind of neurodegenerative disease. And according to this, from the temporal part of the right eye and nasal part of the left eye retina couldn't conduct its impulses to the lateral geniculate body. In this situation, the patient has some kind of difficulties from this part and this part view. It means that the patient couldn't see this part, sorry, these views, okay? And we can call this situation left homonymous hemianopia, okay? And the next, sorry, left homonymous hemianopia, okay, that's correct. And the next lesion is located there at the initial part of the optic radiation. It can cause the same defect that looks like the defect in the fourth, and there is some kind of difference, that's macular sparing. Macular sparing means that the patient may suffer from the left homonymous hemianopia, but the normal function of the macula cannot be damaged. There is two theories according to this. First theory is due to some kind of nerve fibers that's located, that's directed from the macula to the hemispheres. Don't cross. Okay, that's the first reason, and the second reason is the blood supply. You know, the human cerebrum is supplied by three main arteries: anterior, middle, and posterior cerebral arteries. And you know, and the main part of this region of the hemispheres is supplied by posterior cerebral artery. But there is some kind of parts of the hemispheres maybe located there is supplied by middle cerebral artery, and this part of the hemispheres is accepted the impulses from the macula. That's the second reason and theory. Okay, so the macular sparing can occur, and the next two symptoms is due to the final part of the optic radiation lesion, and due to their lesion, I draw there this optic radiation, and there is two bundles. First bundle is cross near to the parietal part of the hemispheres, and they are responsible for the carrying information from the lower half of the visual field. Okay, from the lower half of the visual field. This bundle carries information from this part, and this bundle carries information from this part. Okay, and due to their one-side lesion, the one quadrant can be damaged. Okay, according to this, the impulses that's carried by the upper left quadrant in these fibers. These fibers accept the impulses from the upper quadrants, left quadrants. According to this, left upper quadrant hemianopia can occur, and these fibers accept the impulses from this part. Okay, these fibers, that's 7. Okay, accept the impulses from the lower quadrant. Okay, according to the damage of the optic radiation from this part, the patient can suffer from the left lower quadrant hemianopia. And I should admit that that's a little bit difficult to understand and explain this lesson, but for becoming a good neuropathologist, we should learn this. Okay, I try to explain you and teach you as possible as according to my ability, my teaching ability, and all of the information that's prepared for today's lesson is all. Thanks for listening and watching. If you have any some kind of greetings, maybe some kind of suggestions, we are always ready to accept from you in the comment part of our YouTube channel. Take care of yourself. See you next time.